to our intro to our digital health market model. I'm Amy Cameron, Principal Analyst on our healthcare practice, and I'm here with Darius.
Yeah, hey guys, I'm Senior Consultant in SEO Partners and the Digital Health Practice Lead from the consulting side.
Yeah, and we put this model together. So why did we do it? What is it for? We have been covering the healthcare vertical as an opportunity for telecoms operators for several years. And one of the questions that we get a lot is, what is this market worth to us? You know, how big is the digital health market? And so we've started to answer that question with this. And it's also very interesting because obviously COVID has had a significant impact on the digital health market. So we're doing kind of two things with this. Our aim was to understand how big is the digital health market, how fast is it growing, where are the biggest value buckets in the application areas that are relevant for telecoms operators, and also to understand how that has changed in the COVID environment, and you know, what's really taken off, and of the things that have taken off, how are they going to impact healthcare providers in terms of cost savings? So that's what we're aiming to do. It's the first part of two parts of research, where on the second part we'll hopefully, or we will break out the cost savings that we model in this model into revenues. So let's start off with a few definitions. So what we did is we built out 4 different scenarios that model the costs of delivering healthcare across the application areas that we've covered. And I'll dive into the application areas in a couple of minutes and start off by explaining the cost scenarios that we look at. So the first cost scenario is kind of like the base case. What does the world look like with no COVID? So what is the penetration rate that we're seeing from digital health solutions in a pre-COVID world, and how is that changing out to 2030? After that, the second one that you can see on the list here is more of a hypothetical. It's a control factor that we can compare the other scenarios against, and we call that the flat digital health scenario. And that's hypothetically, imagine that the penetration rate for digital health solutions doesn't change at all from 2019. And how does that impact the cost to delivering healthcare if we don't use any of those technologies any more than we are in 2019 by 2030? The third scenario we have is with COVID. And this is broken out actually into 2 scenarios. The first one here we call is with COVID real world. And that is understanding what the cost impact is on the healthcare market after COVID. So with a higher penetration rate of digital health solutions, which was the case across a number of areas that we looked at in this model. But the reason why this one is different, the real world, was that a lot of the things that we modeled, so for instance, the number of visits to an emergency room, which should be reduced if you have better access to digital health triage systems, or, you know, doctor's visits that could be avoided if you have a remote monitoring solution. Those are the same things that were impacted during COVID. So people stopped going to the emergency room. They deferred care during COVID, and that resulted in a drop in usage of these services and created a sort of dip in our cost scenario. So we have that with COVID real world. But for the purpose of this model, we focus mostly on the second one, which is the with COVID digital health impact only, where we've sort of artificially cut out the real world impact in terms of usage of healthcare services, and try to understand really what was the impact of increased usage of digital health services on the cost structure in the healthcare market. So those are the 4 scenarios that we looked at. And by comparing those 4 scenarios against each other, we can then come to an understanding of what are the cost savings driven by digital health. And so in this model, in the database sheet, which Darius will take you into in more detail in a minute, we outlined 2 different cost saving scenarios. So the first cost saving scenario, which we've sort of labeled the COVID digital health dividend, is the difference between uptake of digital health in a world with COVID versus in a world with no COVID. So how much has the market been accelerated and what's the value of that acceleration because of COVID. Now, the other one, which is more of a control scenario, is the comparison of the world with COVID and a flat digital health growth. And that's kind of to, just be able to compare the acceleration that COVID has created. What degree is that? How big is it compared to, the overall impact of digital health on the healthcare market? So those are the cost scenarios that we look at. And we didn't model the whole of the digital health world because it is massive. What we modeled is the application areas and the use cases that we think are most relevant for telecoms operators. And we effectively cover 4 application areas. So the first one is remote monitoring. And I won't go into all the details of the use cases, although you can see we cover them here. We look at remote monitoring for people at home, for people in care homes, in hospitals, for people and things. And so we have 5 use cases there. Then we look at virtual care and telehealth, and that's both in primary care and in secondary care. And then we also look at appointment bookings. Third, we cover diagnostics and triage. And this is really, trying to understand how you can use AI-enabled tools to triage patients better. Do they need to go to the ER or not? Which physician or which healthcare provider should they see? And then to diagnose their ailments more quickly. And then finally, we have the data and analytics category. And it's important to note that this is separate than the data and analytics that you would run within a remote monitoring solution or within a diagnostics and triage solution. We're thinking more about the population level impact. So within this, we're looking at 2 things. One, the impact of universal healthcare records, if and when they become a reality. And the second is mostly the implementation of population level analytics, particularly for things like epidemiology and understanding, where to put healthcare dollars and to identify at-risk patient groups. So that's the intro of what we cover in our model. And I will now hand over to Darius to tell you a little bit of what's in there and how it works.